Today's topic is clavicle. It is also called as collarbone. It is a modified long bone. The bone has curved part and two ends. The curved part of clavicle is also called as the shaft, and it has two ends. This is the lateral end, and this is the medial end. The shaft is divided into lateral 1/3 and medial 2/3 part. So this is the gross anatomy of clavicle. There are some peculiarities of clavicle, which you need to know, that is, clavicle lies horizontally. It is the first one to ossify. It is only long bone which ossifies ink membrane, and it has two primary center of ossification. It has no medullary cavity and is subcutaneous throughout, so these are the peculiarities which you need to know. It is important from the example point of view. So after the gross anatomy of clavicle, you need to know how to determine the side of clavicle. So for determining the side, you need to know 2 points. The ends and the surface. If you can find out the medial end and the superior surface, you can know the side of the clavicle. So how do you determine the medial end? The medial end is large and quadrilateral, whereas the lateral end is flat. After determining the medial end, you will look for the superior surface, so this is the superior surface and this is the inferior surface. The inferior surface is rough as it has subclavian groove, costal tuberosity, conoid tubercle. Whereas the superior surface is smooth, so by finding the medial end and superior surface you can determine the side of the clavicle. Now we are going to the features of shaft. As I have already told, it has lateral 1/3 part and medial 2/3 part. Lateral 1/3 has two borders and two surface, the anterior border and posterior border, and it has two surface, superior surface and inferior surface. And in inferior surface of lateral 1/3 part has a leviation called as a corner tubercle and a ridge as a trapezoid ridge. Now, talking about the medial 2/3 part, it has no border, it has four surfaces, that is anterior, posterior, superior and inferior. And in inferior surface, have oval impressions at the medial end, that is costal tuberosity and the subclavian group in a lateral half. So this is the features of the shaft. So after features of the shaft, we are going to talk about the features of ends. The lateral end or acromial end bears a facet that articulate with the acromion process of scapula to form the acromioclavicular joints. And this is a medial end which articulate with clavicular notch of manubrium sterni to form sternoclavicular joint. So this is in the text form. Now we are moving toward attachments. We will divide the parts into the lateral end, medial end, lateral 1/3 part of the shaft and the medial 2/3 part of the shaft. This is the lateral end. It is the articular surface for the acromial joint, so it gives attachment to the joint capsule, and the medial end is articular surface for the sternoclavicular joint, so it gives attachment to fibrous capsule, articular disc and interclavicular ligament. So this is attachment of end part. Now talking about the shaft. In the latter 1/3 part we have the origin of deltoid muscle, an insertion of trapezius muscle, and for the ligaments we have conoid ligament, and for the medial 2/3 part, we have origin of sternocleidomastoid muscle, pectoralis major muscle, and sternohyoid muscle, and we have also the insertion of a subclavius muscle. Beside this, it also has costoclavicular ligament. These are the attachments of clavicle here. Here we have the chart. So in the lateral and the medial end there are no muscles. In the lateral 1/3 part of the shaft, there is origin of deltoid muscle and insertion of trapezius, and the medial 2/3 part of the shaft has a origin of pectoralis major, origin to the head of the sternocleidomastoid muscle and origin of a sternohyoid. It also give insertion to subclavius. Now for the ligaments, the lateral end is articular surface for acromioclavicular joint giving attachment to the joint capsule. It is articular surface for sternum to make a sternoclavicular joint, and it gives attachment to fibrous capsule, articular disc, interclavicular ligament, and in the latter 1/3 part of the shaft, in conoid tubercle and trapezoid ridge, it gives attachment to conoid and the trapezoid part of a corticoclavicular ligament. And at last we have costoclavicular ligament in medial 2/3 part of the shaft, so this is the summary of attachment. Now for the applied aspect, the most common site of the fracture of clavicle is a junction between medial 2/3 part of the clavicle and the lateral 1/3 part of the clavicle. So this is all for the clavicle.